morning. So I'm here to perform an incentive spirometry. So first and foremost, before going to the patient's room, all you have to do is check the patient's chart, obtain pertinent information, and then once you're done, once you're going inside, we should always introduce ourselves and then let the patient know what are we trying to do and explain to them thoroughly, such as this way, like good morning, Mr. Anthony, and my name is Anthony also. I'm a respiratory care student from the respiratory department. So I have here holding incentive spirometry, which is a therapy in order for you to help expand your lungs even more, and at the same time allow you to cough and also remove secretions, and this would help you prevent from your lungs to collapse, especially you just came from surgery. So after that, we always make sure we assess the patient, and then one of the things that's very important during assessing the patient is we always auscultate it, and then we also have to check the ID bank to ensure they are the correct patient. And then once you're done, we wash our hands and then we proceed in doing the therapy. And then when doing this therapy, we always make sure that we inspect the device, especially if there are any cracks present in here. And then when also performing this therapy, every time we do this is make sure we demonstrate in front of the patient so that they would fully understand and how to properly do this one. So first and foremost is we remove each one, and then when getting our goal, we also have to check it in here with a designated gender, such as myself. I'll be doing as myself as the patient. So male, so my age and my height. So definitely mine is, my goal is I need to reach it about almost 2000. But anyways, when doing also this one, especially we notice to have some elderly patients, we allow them to start at a low level, even though we have a goal, and then gradually increase it if they are able to tolerate. And then when doing also this is first we position this one upright, and then let the patient exhale all the air out until you feel their lungs are empty. Once you feel your lungs are empty, we're going to insert the mouthpiece inside the mouth, and then make sure it's sealed completely with their tongue below. And then they have to let the patient take a slow deep inspiration, and then gradually hold the breath for about 3 to 5 seconds until such time this white piston would drop, and when it drops to 0, remove the mouthpiece and exhale normally. So moving on, let's proceed it while performing. So first is I'm going to exhale all the air out. If you wanted to do this multiple times, the ideal for this is at least 10 times. But every after attempt is we let the patient rest for a few seconds. And if possible, if some patients who experience any dizziness or like hyperventilation and nausea, please immediately terminate the therapy to prevent any complications. And then once we're done, let the patient cough every after performing of this therapy. And then when everything's been done, you make sure that we return this one in the plastic container, and then with the mouthpiece we cover it with a clean tissue, then put it inside. And then also important thing for doing the incentive spirometry is that we always, if we have to let the patient practice it every hour, especially more on the waking hours in the morning. And then if it is also indicated for patients who are able to understand, able to cooperate. And also once everything's been done doing the therapy, always ensure, as what I mentioned, to let the patient cough if they have secretions present, and always re-auscultate every after, and then obtain any vital signs. And if all things goes well, wash our hands, and then document everything, and then make sure that we always put up in the chart if what's our initial impression on what the patient was able to reach on this one. So I think we're good.